There is a candidate's pledge of support for the New York Health Act, and I wonder if you would take a look at it and see if you could sign it.
Oh, yes, Ellen. It definitely means I'm a big supporter of the New York Health Act, and I'd be happy to look at the pledge.
I mean, I'm all in. I think, again, I want to reiterate my belief and my value that healthcare and access to high quality healthcare should be a human right. People should not have to go broke to get healthcare. People should not have to prioritize one thing over the other to get healthcare. And so absolutely 100%. And, you know, I think
am definitely for the New York Health Act. And I believe that I signed something before, but if you want to send it over to me, I will 100% sign it again.
Signed it yet, but absolutely, I'm in favor of the New York Health Act. Like I stated in my questionnaire, and you know, I believe we should have a single payer system. I believe healthcare is a human right. You know, as board chair of the Mixteca organization, and an organization that was founded to directly support immigrants with preventative healthcare and access to care, I understand very well what it means and what it looks like when we don't provide care to those who need it the most and who are most vulnerable and excluded from our system.
So I support New York Health Act. I think we have a supermajority. I think we just need the political will to kind of get it done. So I'm happy to support, you know, your efforts in getting that passed.
Whether or not you support the New York Health Act, and if you do, if you will sign a candidate's pledge that is online.
Yes, absolutely, 100%.
Health Act, which would be a statewide Medicare for All program, and if so, we do have a pledge.
Emphatically, enthusiastically, yes. Healthcare is so personal to me, having navigated a system that is not patient-centric, not family care centric. And so I look forward to signing on and committing to just continuing to work with you all as we move towards universal healthcare in our state. And so yes, to signing on the New York Health Act. I think it's our only effort to again move towards universal healthcare access.
I was for that.
Yes, absolutely. I would be interested in signing the pledge. I support healthcare for all. That includes immigrants and people, all kinds of people who need healthcare. Healthcare is a right, and I think that we all should have it.
Thank you.
Thank you, Sarah. So yes, I absolutely would sign. We need to take care of healthcare workers to make sure that they can take care of the patients. And we have to ensure that the people have access to adequate healthcare.
Yes, I'm a supporter of the New York Health Act, and I'm a supporter of people other than people who need Medicaid or Medicare to have better access to health insurance. You know, the co-pays that people pay are like extremely high. I think that there's a way that we possibly can deal with that by taxing the rich or whatever, so that way some of that money can also be brought over with healthcare.
We were organizing around it, and I was a supporter then. I was a supporter 10 years, maybe years before that, because of the elements that's in it, and I remain a supporter of it. And I will use my council seat as a voice both in the city, and I will travel up to Albany to be supportive. And I will put in the resources necessary to have world-class hospitals so people can continue to understand why it's important that we have publicly funded healthcare and that we don't continue to shift everything into the hands of the private organizations, which are driven by profits, not health.
Pledge to pledge your support for the New York Health Act, which would be
your button is on my backpack. Everywhere I go, it's there. I'm going to support your pledge. And yes, I do support the passage of the New York Health Act. You have my support too. My students, a lot of them don't get to see doctors. So my school is not a community school, but I made it into a community school. So some of the students, it's at the school that they get to see a dentist. They have never seen a dentist before. The things I take for granted, I can walk into the hospital. Most of my parents, especially my immigrant communities, don't have that. If they don't have insurance, they either also lack the language access. So that's another thing. In order for them to get the services, they also need language access. So that's where it is for me.